the vaccine has gotten tainted in the partisan and culture wars that afflict so much of American and global Christianity, unfortunately. And so in reality, part of what we're doing with our Christians the Vaccine Project is to show that there really are not legitimate religious or biblical reasons to resist the vaccine, and to try to strip away any sense that that's really what's going on. And instead to just put it frankly, that actually what's happening is cultural, partisan forces and misinformation from my perspective that's driving vaccine hesitance.
Yeah, there's so much confusion out there, Curtis. Another issue many Christians have voiced concern about is the use of aborted fetuses in vaccines. What have you learned about this?
Well, we have a whole video on our site. It's a important issue. It takes a little time to get into. So we really encourage folks, if that's really what you're concerned about is the use of fetal cells, then to watch our video. That's about 15 minutes on it. The short answer is that there were no fetal cells that were used in the actual development of the vaccine. It's only, and no used in the research as well. We're talking about descendants of cells long ago, and these descendants of cells are widely used in almost any form of modern medicine, such that if you are taking ibuprofen or over-the-counter drug or are being treated for any medical condition, you're actually benefiting from those same fetal cells. And so this is why all of the leading Christian ethicists have said, you know, the use of those fetal cells are not a reason to not get the vaccine, because if you were to be consistent with that, you'd have to withdraw from modern medicine almost entirely.
Interesting. You also spoke to Dr. Robert Jeffress, who's a pastor, obviously, of one of the most influential churches in America. And you sat down and talked to him about the vaccine. He said being pro-life was his motivator for getting the vaccine. Explain this.
Well, it's because we're pro-life means you're concerned about the life of others. And so even if you don't think that you need the vaccine for yourself, others do. Others who are immunocompromised, elderly, children who can't be vaccinated. You should be taking this for the concern of others. And that's really the heart of pro-life concerns, is concern of life for others. One of the most tragic things about the COVID vaccine resistance is how much you hear language like my body, my choice in terms to justify vaccine resistance. As Dr. Jeffress said, that is the exact same rationale that the pro-abortion movement uses. And now we're hearing it from Christians, or at least people who purport to be Christians, to justify their vaccine decision.
Yeah. Yeah. Is there room, Curtis, for faith and science to work together? The issue of vaccines,
absolutely.
and for us here in Canada, we're now talking about vaccine mandates, and passports have become so divisive and has drawn families apart. How do we have meaningful conversation with those who might disagree when it comes to this issue, when it comes to science and faith?
It is such a challenging issue to deal with divisions in our family, our churches, and so forth. I think these things are best handled in direct relationships where people are actually responding to true information, to facts. That's why we produced the videos that we did. They're meant to be short, shareable videos that a family member can share with another family member. And rather than the family member making the exact arguments, they can sort of respond directly to this video and then have a discussion around it. And we hope that that can actually open the doors for some conversation.